No, not there.
Parents also record the video.
Arushi, are you able to hear any other background noise from our side, the fan sound or something? You're able to hear it?
No. I mean, we meant the sound of the fans. Okay, no. Hello all, welcome to another session of YouTube live classes. By the way, Dr. Anusha, welcome to the session.
Well, yes. Thank you so much, Ms. Arushi. And welcome to all of you as well today. And today we will be looking at the speaking module.
So we are very eager to share you some tips and strategies related to the speaking module.
Yes. So are you ready to get into the specifics of the module? So you can drop in a hi in the comment box and we will know that you're there.
Yes. And we hope that you are enjoying the sessions. The same time, like by the hand, you will have a great learning experience in this session too.
Yes, you see, these sessions are aimed to make you better at the modules because we are dealing with the specifics, as I already mentioned, and you will get to understand what will exactly work in an exam, right? So please make sure to keep your book and pen ready. And apart from talking about how the speaking module works and what you should be looking into, we both will actually be doing a sample role play so that you guys are able to understand and follow how to empathize with the patient or reassure the patient and the like.
So we would also be highlighting on the part regarding the criteria that has to be maintained. So we would talk about the clinical criteria and the linguistic criteria.
Yes. So these play a very important role in a role play, as you all know. So coming to the linguistic communication criteria, if you have already been a part of our sessions the previous weeks, then you will understand that empathizing with the patient, reassuring the patient, and you know, information giving, information gathering, these come under the clinical communication criteria, wherein the intonation, clarity that you have with pronunciation and
the language use.
Exactly, the grammar, all these play an important role in the linguistic communication criteria.
Not to forget about the voice modulation.
Exactly, very important because this is, the assessors will be listening to your audio, the recorded audio. So it is very important for you all to understand how important your voice is during the speaking module that you'll be doing on the day of the exam. And also, please make sure to maintain a proper posture,
yes,
which will give you better clarity in voice. Everything is related, guys. So,
and I think we did mention about the don'ts.
Yes, we did.
Yeah.
We can go through the don'ts again
yes,
today before the session ends. We will surely go through all that. But please make sure to have a book and a pen with you at all times. And also, do drop in your comments or questions, anything that you have here in the live chat box.
Yes.
So we welcome you all to our YouTube live session, and this is by Charkos Global.
And as you know, it's our fourth session.
Yes.
Fourth live YouTube session, and thank you for acknowledging our efforts through your comments, and we are happy to see that it has been useful for so many people.
Yes.
So keep watching, keep encouraging, keep commenting. Please do subscribe for our channel to stay updated.
And yes, we have our our viewers wishing us good afternoon, Shanti. Good afternoon, Malsami. Toby, hi. Hope everything is good. And yes, definitely. We will be talking about fluency and vocabulary.
So it's nice to see that the viewers have generated that curiosity of knowing when is the reading class. Well, Shanti, we will be soon planning for it. Probably in the next 2 weeks.
Yes, in the next week, maybe we will be doing a reading session. We'll be taking it up. See, the point is, we just want all of you to, understand how the classes work, and any which way if you have queries regarding the classes, you can always post it here in the chat box.
Yes.
And we will be getting back to you soon.
Well, since 15 plus years, Charkos has been a one-stop solution for the education, training, and recruitment.
Yes. So we have been one of the most sought after organizations in education, be it education, training, recruitment, and we've always been there, and we have always, it's our priority to be a part of your journey.
Yes. Yes, we'll be just moving the slides. So I think you might all be very familiar with these slides for now. Mm-hmm. So you can just have a look at these slides. So it does mention about the OET, the modules, the target audience, and the other details related to OET.
Yes. And so it is tailored, as you know, to 12 healthcare professionals. And moving on.
Well,
So,
current slide gives us a brief outlook into the details of grading, and be sure that you have to score a B grade, which is 350 to 440 marks in the speaking module.
so now that we have looked at this, we'll be moving on to the next one.
So the current slide gives us the clear detail about the OET being recognized by different countries, including Australia, New Zealand, UK, Ireland.
Yes, all these countries accept OET, and it is accepted and recognized by regulatory bodies, hospitals, and universities.
Yes.
And now moving on about the registration. See, and one thing that all of you should understand is this is paid in Australian dollars. So when you're checking the currency and when you're checking the exchange, please make sure that you are typing in INR to or AUD to INR, and you'll get the right amount. So the OET exam fees comes to approximately 32 to 33,000. And as you know, it is taken twice. It is conducted twice a month.
And the certificate is valid for 2 years.
So speaking criteria and marking criteria, we have spoken about this in detail in the previous session. Please make sure to go through that session on our channel, Charkos Global, and you will get to know about the role play scenarios, what the specific task types are, the marking criteria, and the duration of each role play. And the linguistic criteria here, could you please tell us?
It talks about the intelligibility, fluency, appropriateness of language, and resources of grammar and expression. I think that is what we did speak about in the beginning of the session. We did mention about it. We spoke about the polite language, avoiding jargons, and fluently speaking without any pauses. And obviously, speaking without any grammatical errors.
Yes, that's important. You see, we all tend to make mistakes, but getting a little conscious of it and trying to change it when we can is what will help us speak better and well.
And I think confidence plays a very important role in speaking.
Yes, it does.
So, because as you know, the conversation between you and the interlocutor is recorded, and that will be sent to the examiners, later for the actual evaluation. So if at all you are trying to express your sympathies, empathies, or compassion for that matter, there is no screen as such, wherein you can express through your expressions.
Yes.
So whatever you are expressing only with the voice.
Yes.
So confidence plays a very important role over here.
Yes. Never doubt yourselves. Never ever doubt yourselves, because see, another important factor that we keep telling our students is OET. They are not checking your medical knowledge. They are not testing your medical knowledge. Instead, they're just trying to test and assess how good you are when it comes to language, the English language. So please make sure to be really confident and also adopt strategies to work around the module, which will help you score better.
I think one mantra would help here that I would like to share. It is not that we can't.
Yes.
You please have the positivity in you. Please think positive and always have the mantra, yes, I can do it and I will do it confidently, should be your mantra.
Yes, and this is what we teach in our classes as well. And
Yes.
this is the support you'll be getting in our online and offline classes at all times.
I think if you're interested for the classes, definitely we are available online as well as offline at Gurugram and Mysore.
So please do get in touch if you have any queries related to the classes, and our team will get back to you immediately.
Yes.
So about intelligibility, we have spoken about
Yes.
this. Can you just highlight a few important pointers from this?
It is nothing but being very simple. It is just to know, have you spoken correctly, or whatever you have spoken, has that been understood by the examiner or the interlocutor correctly? That's it. So pronunciation plays a very important role here. You have to pronounce the words very correctly, and the pace is also important. You should neither speak too fast nor too slow, where you have to maintain a natural rhythm. And so I hope now they would have got an insight into what is intelligibility.
Yes.
Actually.
Yes.
To put it on in simple words, it is nothing but whatever you're trying to communicate has to be understood by
The other person.
Other person. That's it. So fluency.
So fluency, it refers to the smoothness of your speech. And, the thing is, you're not supposed to pause for a long time searching for the right words. We all tend to use, okay, well, of course, we use these, but when to use it and how to use it is important. So that it actually matters. You just can't keep pausing in between while speaking. So please make sure that you're not pausing at regular intervals, but just once, twice during the conversation should do.
At the same time, you should not repetitively say few words. That is also important. So backtracking has to be avoided.
Yes.
So that is something that holds back the fluids. So you have to be very careful with these things. Well, Dr. Anusha, could you please tell us about the appropriateness of language?
Sure. So, see, you are a medical professional, you are a healthcare professional, and being one, you are aware of so many topics, right? And you all know these complicated words and you know about so many problems and conditions. Well, as a patient, if I'm the patient, then I would not know anything about the problem, the condition I'm in. I may not know about, for example, I may not know what dialysis is. I may not be aware of a green stick fracture. What is a green stick fracture? So these are terms that have to be explained to me in a language that I can understand. So basically, you are not supposed to use strong medical terminology to explain these, conditions to me. I being the patient. So if I'm asking you, well, nurse, I really don't know what dialysis is. Could you please explain it to me? Then you should go ahead and explain it in such a way that I'm able to follow what you're saying. Right? So this is what appropriateness of language refers to. Along with this, the tone of the voice is important. So the right volume, the right tone, and we had also mentioned this last time, when delivering bad news, you will not get a very stark scenario. But if it is a regular one, please, if you're just giving news like something related to the current health condition of the patient, which may deteriorate if at all they do not accept a procedure or probably some treatment, then you'll have to adopt a right tone to say it. Yeah.
Yes.
So please make sure that you are not assuming things on, when you look at a patient.
And one thing that has to be considered here is the interlocutor might be or might not be from the medicine background.
Yes.
So you have to keep it. That is why keeping it simple, clear, concise is important. So obviously it is very important, as you know, it is a language assessment exam. So obviously you have to use the right language with no mistakes.
Yes, correct. So, and as ma'am already said earlier, it is important to paraphrase and to repeat. You can please do check out our previous session on speaking. You will understand why we are stressing on that. At the later part of the conversation, once you've completed everything, then you can repeat a few points from the conversation.
Yes. So the clinical communication criteria does deal with the relationship building, patient's perspective, information gathering, information giving.
Yes.
So first one is how good you are in building the relationship. One thing that you have to keep in mind is like, obviously you are the bridge between the patient and the GP. So if at all the patient needs someone in the facility would be the nurse.
Correct.
So it is very important to develop a good relationship with them, because it is you with whom they first talk about everything.
Yes.
They would express their concerns, they would talk about their past history, and that's why you have to be very non-judgmental in your approach.
Yes.
So you have to have the right tone while speaking, and definitely this is where empathy and sympathy comes into help.
It does. It does. So you will need to show an interest in what the speaker is saying. So, for example, she's the nurse and I'm the patient. So she would actually ask. She'll have to ask me questions that will just give me some assurance, saying, well, yes, the nurse is interested to know how I am feeling today. She is really concerned about me.
Yes, that helps us in building good relationships.
Definitely.
So probably you would say that I think we did mention that in the previous session as well. So how can you do that? You can say, yes, I understand your concern. It is totally reasonable. If I were in your place, probably I would also have thought the same way. So please don't be worried. We are here to help you. You are in the safe hands. We have got a good set of the wonderful experienced team. See, these phrases would give a kind of confidence in the speaker's mind. So the patient's mind that matters. So obviously that helps in developing not only the relationship but the trust.
Yes, it's important because we trust you guys a lot. And so it's, that sort of creates, there's a lot of clarity and there's smoothness. And we are able to follow what you're saying, and you're also not judgmental about us and the condition we are in.
So trying to understand the problem from the patient's perspective. So it is not that's where being non-judgmental comes into the place, and you have to be a good listener. So that should be one of the important qualities that a nurse should develop for that matter. So you have to patiently listen to whatever the patient says. Because definitely you would have come across n number of patients, and you cannot expect everyone to be the same.
Yes. And the patients can also be, they'd be quite, strong about their opinions. So even if they're strong, how are you going to convince them, right? How are you going to, request information from them if you want to give, them solutions? So you'll have to be really patient with a patient and also understand them, right? And you'll also, as you see here in the last point, we have stated that you're expected to pick up on the speaker's cues such as pauses, hints, hesitations, change in volume. Because not all the time, as soon as you read the patient, as soon as you ask them how they are, they're not going to openly say, well, I'm not feeling so good today.
Yes.
Yeah.
And definitely, few patients, the scenario might goes like this. Gone like this, where they would never stop talking. Few patients, definitely, you can expect them to say nothing but, I'm fine. I'm not fine. So you should be able to balance.
Yes. Yes. You should be able to do that. And also, see, the thing is, when you're doing it, you also have to take cues for these pauses and hints and the change in volume. Another thing, guys, that we would like to tell you is you're not preparing just for the exam, right? You're bracing yourself to prove your mettle in a country different from your own. And that country speaks English. Their native language is English. So what do? How do you present yourself? How do you speak? How do you analyze a situation? That is what the exam is about, and that is why speaking is very important.
Yes. So the structure of the role play, of course, you are expected to be in charge of the conversation throughout. And keep one thing in mind, it is always you who will start the conversation. And you're not supposed to end the conversation unless you are asked to.
Yes.
Right?
Yes. If the time is up, then you're, of course, supposed to stop. If not, please go on. This is where the repeat factor comes into play.
Yes.
Yeah.
And how can you avoid that? Probably there are some cases where you would completely talk about everything that is given, probably 30 or 40 seconds are still left with. So probably you can utilize that time to summarize the whole conversation.
Correct.
So you can talk about some points that would be beneficial by stressing on those points. So you can utilize the time like that and you can summarize. So you have to carefully plan your role play in such a way that you neither miss out any prompts given, not just complete it in advance and sit like that. So timing plays a very important role.
It does.
So there are two things again which you have to keep in mind. One is information gathering, one is information giving. Both are equally important. Both are equally important. So information gathering is nothing but trying to gather the information from the speaker or the patient for that matter. So as we have already told, some patients might be hesitant, some might be adamant, some patient might not cooperate with you.
That happens with mental health patients. You know, when you're at the mental health clinic and you're talking to an addict, maybe, then this is one area, you know, one setting that you'll have to be a little, you'll have to put in a little stress, and you'll also have to work a little harder at gathering information.
Yes, I have one more point here. Obviously, there are few points. There might be few points where you will have to extract data related to 2 or 3 different things. But it doesn't mean that you have to frame a complex question using all 3. Rather, keep your questions very simple and don't ask open-ended questions. So you should frame the question in such a way that you get a simple answer. So your questions should be appropriate to the role. So as I've already told, information giving is also equally important like information gathering.
So it is important that the speaker knows more about the subject before moving on to the next point. How do you close your conversation?
Definitely, you can't just say thank you. Your closing conversation should be based on the setting. So few role play would have the hospital ward as the setting, then you can close the conversation by saying that here is a call, please press it, someone will be there for you shortly. Or if it is a home visit, you can say them, I'll see you soon. If you have any concerns, please do feel to contact me. This is my contact number. So, or you can also say thank you.
That's
easiest way.
Yes, if at all you forget it, because you know we tend to get anxious, but please don't get anxious on the day of the exam. But if at all you do, and if you don't know anything else to say, end it with a simple thank you.
If the patient is suffering, probably they can add a wish you a speedy recovery.
Yes, you can surely do that.
And definitely one thing that I cannot stop it. Dr. Avisha, I can probably you can assume this when you go for speaking. Obviously, on the day of exam, you cannot avoid the anxiety, the last minute anxiety. So one thing that would work here is just for a couple of minutes or 30 seconds to 1 minute, just close your eyes, take deep breaths, and assume that you are nurse and the opponent is your patient. Half the problems will be solved.
It will be solved.
So when you have that notion in your mind, yes, this is an exam, I'll be assist. So that is going to trouble you for some time. Rather, you would definitely have worked as nurses, and this will work with you.
Because you are a trained nurse.
Yes.
You're a trained nurse, you're a trained medical professional. So be it anything, be it you're a doctor, a nurse, anything, but please make sure that you're, imagining yourself in the exact situation.
Yes.
To let go of that fear.
In this way, visualization can help you a lot. Start imagining this thing, whatever you've read, just imagine that yes, you are a nurse and there is a patient and you're conversing with a patient.
Yes. And if you have any questions regarding the points that we have discussed till now, please drop a comment in the chat box and we'll answer it as well.
Yes. These are the beautiful pics of our nurses who have successfully joined in the UK. It's nice to see them getting settled over there.
So we have now looked into the points regarding clinical communication and linguistic communication criteria. Now, let us look at a few strategies for effective communication.
And I think these are the things that's really going to help you out. So please absorb it, note it down. So how do you involve yourself in the active listening? So these are some of the strategies that would really help you. The first thing, I think we've already mentioned about it. It is all about the active listening. Mm-hmm. So when the interlocutor or the patient, for that matter, is speaking, it is very important to pay close attention to what the person or the interlocutor says. And if you have any doubts, it is very important not to have the doubts. It is very important to clarify it then and then. And please keep in mind, during those 3 minutes of the preparation, you have all the rights to clarify your doubts, if at all you have any doubts. Mm-hmm. It might be the pronunciation, it might be the condition.
To be the meaning of a word.
Yes,
if you don't know the meaning of a word, please ask. And if you want to also ask the name of the patient and how they want to be addressed during the conversation, you can definitely do that. See, today we will be doing that. So we had a question about known case and unknown case. This factor is usually applicable for the writing module, but it can also be used, definitely be used in the speaking module as well, because some students are of the opinion that you'll have to start the conversation directly with the patient's name. Yes, so you can do it, you may or you may not do it. So there are different ways of handling a setting and the conversation. So we will be looking into that and say we will also be giving you a sample. We will be doing a sample role play today, 1 or 2 if time permits. Let's see. Clear and concise language, as we've already stated. Use language which is simple, straightforward to communicate your ideas effectively, and avoid the use of technical terms or what we call jargon, which the patient would be unfamiliar with. All right. The key to doing a role play very well is to have clarity in what you speak.
Yes. And why should be the jargons to be avoided? Because as we have already told you, the interlocutor might be or might not be from the medicine background.
Yes.
So avoid jargon. That is where, like we tell, that it's very important to keep simple, straight, concise. Mm-hmm. That's it. So that's going to help you here. And the next, maintaining a professional attitude is very, very important. So you have to use the polite language, and your conversation should be very formal, and that has to be maintained throughout the interaction. So showing empathy and understanding the problem from the patient's perspective plays a vital role here. So as we have already told you, showing empathy would definitely help you up in developing a good rapport between you and the patient. Okay, I hope you have got these things. No, these are a few FAQs. After this, I think we will definitely start with the sample role plays.
Yes, we will be doing that.
Well, will we get the role play card? Yes.
Yes.
You will be getting your role play card, and you will also have the pencil if you want to note down some points. Especially one more tip is that definitely when you ask the interlocutor how would they like to be addressed as, they would say Miss Smith, Mr. Smith, or call me John, call me Mrs. Elizabeth, or something like that. So definitely you can jot it down so that you will not forget it. And one more thing is, like, please do not miss the order so that you will not miss any prompts.
It's not compulsory for you to follow the order, the sequence that is given in the role play card. It's not compulsory, but we would want you to follow the order, the sequence, because it's logically placed, of course, and it connects the dots easily. You'll be able to explain well. You will not have hesitation, right? And you'll have confidence, which is important when it comes to a role play.
So how do we note down our thoughts and prepare in the 3 minutes? Obviously, as you definitely would have come across such scenarios, my dears, and keep that in mind. It is not something like rocket science, which you don't understand.
We do say that. We do say that.
So 3 minutes is actually enough to prepare. Yes, it's more than enough.
It's more than enough.
You can definitely note it down with the pencil that you have, and please don't forget to write the patient's name or how would they like to be addressed as. And the third question, yes, you are allowed to write the patient's name. Can I ask the name of the patient during the patient preparation time?
Definitely.
Yes, you can.
Definitely, you can ask. And if I may add another point here for the second question. So, can we prepare in the 3 minutes that we have? Well, OET gives you 3 minutes. Do you know that IELTS exam gives you just 1 minute to prepare? And you have to talk about so many things. You do have ready-made material here in the OET speaking module, but there you don't. So that is always an advantage being a healthcare professional because everything is there.
Yes.
The details of the condition is given. You just have to explain it and help the patient in front of you understand what it is all about.
Yes. Shall we? If you have any further questions, please use the chat window to express that, and we are more happy to clear your doubts. I think we'll give you a few seconds for that.
Yes, you may
and then yes, you may drop in.
So we now come to the end of the slide, but we will be displaying a role play card on the screen. So please make sure to click a picture of it. You can take a screenshot of it.
Well, Dr. Anusha, there is a question. Ma'am, how do we find out unknown and known case? Also known to unknown. Yes.
Okay, known to unknown. All right. So this is with regard to the setting. All right. So if they are an inpatient, then you can ask them their name and how they want to be addressed during the conversation. You can surely do that. And sometimes the patient may have been admitted after an accident, following an accident. They may have been admitted the previous night or that early morning, same morning. So you can ask them the name. There are two ways of handling the scenario. So one simple thing to keep in mind is if they are an inpatient, please do understand that you do know the patient. And if they're an outpatient, always never fail to ask them what their name is and how they want to be addressed.
So obviously, when they are an inpatient, the documentation process would have been completed. So no need to ask them, may I know your name? For the documentation purpose, it makes no sense.
Yes, you don't have to use documentation. Instead, you'll be using verification. If at all you're asking them.
Yes, if at all you are used to such startings, probably you would say, may I know your name for the verification purpose or the confirmation purpose. See, language is so beautiful. You get a number of options. Isn't that, Dr. Anusha?
Yes. And it's really wonderful. Now let us look at a role play part.
Shall I share the screen for them?
Yes, please. You can drop in your queries here in the chat box.
We hope that the screen is visible.
So we have the setting which is a pediatric ward and a 10-year-old boy.
As shall I write it out? Well, the setting says that it is a pediatric ward. A 10-year-old boy has had a tonsillectomy and is due for discharge tomorrow. The parent thinks he should stay longer as they say he is still in severe pain and does not appear to be very alert. He has a fever and looks unwell. He is having difficulty taking fluids and is on Tylenol for the pain. His recovery is expected to take between 10 and 20 days. The parent appears anxious about the child's condition. See, you are speaking to an anxious you're speaking to the patient's carer. The first point is you're speaking to the patient's carer. And the second point is the parent is anxious about the child's condition. So the task prompts goes like this. The first thing says that share the news about the child's pending discharge, find out about the parent's concerns regarding the discharge, explain that a tonsillectomy is a common procedure and his current level of pain is normal. Reassure the parent that a longer hospital stay is not necessary. Hospital infections, you can talk about child would be more comfortable in own surroundings. Explain to the parent that the pharmacist will tell them how to administer medication. And they will also have given about the medication that would be likely in a syrup form. Ask the parents questions about what he should eat. Avoid solid foods that will hurt the throat. And with regard to the question when friends can visit, then you would say when the child feels well enough. When he can return to school, you can say 20 days or when fully recovered.
So the criteria here would be to put it in proper sentences, proper meaningful sentences, so that the parent or the patient themselves are able to understand what you're saying.
Yes.
So
when RHD
yes.
has asked a question, how to clear the OET speaking module? Definitely with all the points that we are talking about today, with the confidence, definitely it is going to be possible.
And also another thing that I would like to add is if you're looking out for classes which are in detail, which give you an insight into how all these modules work and the specifics of it, then do get in touch with us. And this is how our classes are.
Yes, actual classes are like this.
So you can.
And every student gets an opportunity and get the feedback with regard to speaking, writing, reading, as well as the listening module. Well, to start with, let us start identifying the task prompts,
Yes,
the keywords. So this is what you have to do. First, read it carefully and then start highlighting what is important. Okay, so definitely what is the first task prompt is share. You have to share the news that the child is due to discharge. And then find out. So you will be finding out about the parents' concern regarding the discharge. And then you will explain
what a tonsillectomy is and the level of pain being normal. Then within this task, if you can see, there is another task work called reassure. So reassure the parent about the hospital stay not being necessary. And the next one would be explain to the parent that the pharmacist will tell them. So the next task verb is explain. And the one after that,
you will be answering the patient's or the parent's question regarding what they should eat, when can the friends visit, and when the child can return to school.
Yes.
So there are 1, 2, 3, 4, 5, 6 task verbs, and you have to plan your content in such a way that you will not miss any of the points.
Yes. Please make sure to keep these in mind and also make notes for this. See, understand that we are telling you how to utilize the 3 minutes preparation time effectively. If you want to score B grade and above, that is 350 and above, you are also capable of scoring 400, 450. Please keep that in mind. Anybody can do that with consistent practice and also with confidence. And making use of the strategies that we have discussed right now, you can surely ace your exam in all the 4 modules.
Yes.
So now we have these, and in the 3 minutes, what do? You're going to mark these keywords, you're going to mark your task verbs, and also understand what this setting is about. The background to the patient, which is given in the nurse's block, has to be understood, read properly, and then you'll have to start your first task. The first task is always quite tricky. Be careful about it, and you can take it from there. No worries. So now that you have seen and now that we have marked all these, we will give you a few seconds to click, a picture of this particular role play. You can do that. And we will start the...
Let us know how would you start the conversation.
Yes, please.
Use the chat box to mention about how would you start the conversation in with regard to this particular role play. So Harshavardhini, so have you, this is the way she would like to start our conversation. Hello, good morning. That we right.
You can do it, and you don't have to worry. See, usually the speaking module on the day of the exam may be scheduled sometime in the afternoon.
Most of the time it is after
12.
Yeah, after 12, and sometimes it drags till evening.
Definitely 4 o'clock, 4:30. You may get a slot anytime before 5.
And one more. Yeah. Hello, good morning. My name is so-and-so. I'm a registered nurse here. Can I know your patient's name? Well, one suggestion is please don't use can I.
Yes.
You can be more polite by asking them could I, may I.
So may I
would be more appropriate.
It would be appropriate because can is about the ability.
And you can't say it is your patient's name.
Yes.
We can just keep it simple. May I know the patient's name and age for the verification, because it is the word. And we have already told you that when it's a word, definitely the patient will be a non-patient.
Yes, it is
because documentation would have been done and the patient is due to discharge in this case.
So, if they are due for discharge tomorrow and see it's already given that the patient has been there probably for a week or so now, because the parent thinks he should stay longer, as they say he is still in severe pain and does not appear to be very alert, right? So we have to understand that the patient, this patient especially, has been there for quite some time, probably 4 days or 5 days, and now they are due for discharge.
Well, one more reply says, hi, please avoid this, is where being professional comes into place. And it is not a friendly, very informal kind of situation. So you cannot start your conversation with hi.
Yeah, just don't stop at saying hi. Please don't do that. You can. We will tell you how.
Yes.
So in this case, shall we start the conversation now?
Yes. I'm super
Me too. So
setting the timer.
no, we are not going to set the time for today.
Okay.
Let's just help them understand what the conversation is. We'll complete the conversation. What do you think?
Yes.
All right. So
Well, I'll be patient, sheriff
Okay.
in this case.
Uh-huh.
And Dr. Amisha will be playing the role of
Nurse.
the nurse.
So
okay. So one more response here. Hi, good afternoon. Please don't worry. We shall explain you about the condition of your child. We can make it more professional. I think now we'll rephrase it for you.
to worry about that. Let's rephrase it for you, because the condition of the child would make the parent more anxious. If we are using these words, the parent will get more anxious because they're already anxious. We don't want to worsen the situation. So let us just look into how it goes. This is just a sample for you guys, to understand how you can do this particular role play. I think one of our viewers here, Hilam, one of the viewers had already asked us about known and unknown case.
Yes.
So this, we are going to assume it to be a known case because the patient is due for discharge. That's one factor. So being a known case, assume that this is the preparation time that we have.
Yes.
She's playing the role of a patient and I'll be playing the role of a nurse. And as you all know, I'll have to start the conversation. Yes. So during the preparation time, I'll be asking the name of the patient and the patient's caregiver. Here, the parent. The parent can be the mother or the father. Okay. So, may I know the name of the child?
Child's name will be John.
Okay. Age 10.
10 years.
All right. And you'll be the parent?
Yes.
And your name, please?
My name will be Melissa Smith, and you may call me Melissa.
All right. So please understand that the parent here is going to be Melissa Smith, and she wants me to address her as Melissa. And the patient, 10-year-old boy, is John. Okay, so shall we start the conversation? Are you ready?
Yes, I'm ready.
Right. Good morning, Melissa.
Good morning, nurse.
Well, I have some news for you. Would you want to know what it is about?
Yes, please.
See, John is doing pretty well after the tonsillectomy procedure and he is due for discharge tomorrow. How does that sound?
Honestly speaking, I feel it is not a thing that's giving me joy. Rather, that is making me more concerned.
Oh.
Well, you know that he had a tonsillectomy done, but I strongly feel that he has to stay back in the hospital for a few more days. I see him suffering with a lot of pain, and I strongly feel that he has to be kept in the hospital for a few more days for the better observation. rather than hurrying discharge him.
Okay. Well, Melissa, your concerns are reasonable. I totally understand what you're trying to tell me. But, you know, tonsillectomy is a very common procedure. All right. Let me tell you a little about it. Would you be interested to know what it is about?
Yes, I would like to know.
Well, you see, tonsillectomy, as I already said, is a very common procedure. And the current level of pain that John is in is quite normal, right? So please let me assure you that a longer hospital stay is not necessary for John as of now, and he's recovering very well. He is responding to the medicines, and he is fine.
Well, but I'm not aware of the medication. I have no knowledge about giving medicines at home. What dosage should I give, and how often I should be able to give him? So I have so many concerns in my mind. I don't think I'll be able to manage all those things.
Well, yes. About that, I wanted to tell you about that as well. You see, the pharmacist will be telling you how to administer the medication. The medicines have been prescribed by the pediatrician, and you don't have to worry at all because he's just 10 years old. And so the medication will likely be in a syrup form. All right. So it is important for you to understand how the prescription works and also when to administer medication, as the pharmacist will be explaining the same to you. You don't have to worry about that at all, Melissa. Do you have any other concerns about John?
Yes, I do have one more concern. I still see that he has a lot of pain. He's not able to swallow, and he's still on Tylenol. So I'm really worried. What if the pain worsens once he's discharged?
Okay.
And could you please tell me what I'm supposed to do then? Are there any special precautions as such that I should be taking?
Well, definitely. That's a wonderful question. You see, the pain will reduce once he starts. He's already on Tylenol, and there are other medications that are prescribed to help reduce and to deal with the pain. Not to worry. So once he starts with the regular, with regular dosage, then he's going to be fine. The pain will also reduce. Now, another thing that you'll also have to keep in mind to help with the pain is to avoid solid foods that will hurt his throat. All right. So for a few more days, it would be better if you can give him soups or probably porridge, multi-grain porridge, which will keep him healthy and which will also boost his immunity. And you can make smoothies. So these will be pretty soft on the throat and it will not hurt him. This will help manage the pain and he will not find it difficult to swallow as well. And do you have any other questions that you would want me to answer?
Yes, I would like to know when can he go to school, or obviously as a child he would be willing to meet his friends.
Yes.
So when can I honor that?
Well, you see, he can return to school after 20 days because his recovery is expected to take between 10 and 20 days. So after 20 days, it would be preferable to send him after 20 days or once he's fully recovered, because you'll have to come back for a review with the pediatrician after 15 days. So the pediatrician will be in a position to tell you when you can send him to school. So that would be approximately after 20 days.
All right. So you did tell me that syrup will be given and that would help in lessening his pain. But what am I supposed to do if the pain worsens?
If the pain worsens, and if at all it is not getting reduced with the medicines that he has been prescribed, then please come back to this hospital immediately. You can give us a call and we will be there to help you out with any queries that you have.
Oh, well, thank you, nurse, for letting me know and lessening my concerns regarding my son.
No worries, Melissa. But if you have any more concerns regarding John or regarding his condition, you may always get back to us. But as of now, I think I'll be taking a yes as your answer for the discharge. Shall I?
Yes.
Well, that is a wonderful thing because you see, given his age, it is very easy for him to get infected in the hospital, and he's just a young boy. It would be really good if he goes back home because he's more comfortable in his own surroundings. His friends can visit him when he is well enough. So these are things that can be done once he's discharged. But if you have any concerns before that or after you get discharged, you may always get back to us immediately.
Well, I hope you've addressed all my concerns. Thank you, nurse, for addressing all my concerns.
Thank you, Melissa. I'll see you in a while.
Thank you.
So here, yes. So here, what we did was, I hope you've all followed this conversation right now. See, I started the conversation because I'm the nurse, and the ending happened because the time is up, and we've completed all the tasks. So one question that you may have with regard to the reassurance point in the task, in the subtask here would be, ma'am, you told us, both of you told us that we'll have to follow the sequence, and you gave us the reassurance about not staying in the hospital. It is not necessary for the patient to stay in the hospital at the end. So why did you do that? See, we just did it for this reason. You see, in the beginning, I told you it is not necessary for him to stay in the hospital because the patient is doing well. At the end, I added the same thing so that the parent also knows that it is important for the child to go back home and so that they are comfortable in their own surroundings. So that was a reassurance again. So assurance and reassurance are important when it comes to a role play. So hope you've followed this particular role play. And if you have any questions, well, we have Joshua here who says, good morning. This is, yes. Okay, so you say, I'm here for explaining the discharge process. This exactly, Joshua, is not the discharge process as such. We're not explaining the process, but we're just
sharing the news.
Yes.
That's it.
We're just informing them that their child is going to get discharged tomorrow and what the parent feels about it. That is what we are talking about. The explanation of the process is different. That is a completely different scenario.
And please don't start with this is one.
Yes.
Please introduce yourself. Make it a habit. Like we have come across many people who start introducing themselves. Myself.
Well, that is a good point. Myself.
So please do not introduce yourself starting with myself.
Myself, no. That is a very, it's not an appropriate way of introducing yourself.
And yeah, many people who have done that.
Many people you will not believe, but there are many professionals also who introduce themselves as myself. So that would be pretty awkward. The native speakers don't use that, and also it is not proper usage of the language. So make sure to just say, keep it simple. Keep it simple. I'm so and so. I'm Simran. I'm sure. Yes.
Working as a registered nurse in this particular pediatric ward.
Yes. See, this particular case, another way of handling this case with regard to known case and unknown case. That was a question for us, right? So we dealt it as a known case. And one way of starting this as an unknown case would be on the lines of this. Good morning. I'm Anusha, one of the nurses in this pediatric ward. I'll be attending to you today. Well, I understand from the case notes that the child has undergone tonsillectomy and is due for discharge tomorrow. So before we proceed further, if you don't mind, may I have the child's name and age for verification purposes? This is another way of starting the conversation. So you can do this if you want to do it this way.
You can also start, hello, Melissa, you look very anxious.
Yes.
I have a good news for you. Well, John will be discharged tomorrow. Isn't that making you happy?
Yes.
See, there are many types. There are many ways to start your conversation.
But make sure that the point is clear. There should be clarity in your conversation and the information that is getting passed on to the other person.
Yes. Yeah, like the same way, the closing of the conversation can be done just as we did. Thank you.
Yes. Thank you. I'll see you in a while.
I'll see you in a while. You can also say here is a call bell. Please press it if it's necessary. So one of us will be here for your help. Or you can also say, wish John a speedy recovery. You may reach us anytime. These are the different options that you can end your conversation or the close the conversation.
So hope you have followed this role play. Shall we look at another role play quickly?
Yes. I think we will ask the viewers to get engaged here.
Yes, please. We will do that. So you see, the setting here is the hospital and the patient. The nurse's block says, your patient is 55 years old. They have end-stage renal disease or ESRD.
Well, we have one more question, Dr. Anusha. Ma'am, during 3 minutes preparation time, what key points we need to be taking note of?
Well, again, that's a good question. See, you will be marking the keywords on the role playing card. You have to do that. And then you're going to be understanding. See, if you're really, if you're really not prepared or if you feel a little anxious about the role play, what you can quickly do is it hardly takes 15-20 seconds for you to write the introduction. Just note down the introduction. Don't write anything else. You're just keeping the role play card in front of you and probably putting small points of what you want to say, against the task verbs. But apart from that, please do not write down full sentences for the entire chunk of tasks that you have. Please don't do that. Please don't do that. That is a waste of time and you will not be confident when you start the role play. So it is important to be, to start off very well, right? So make sure you do that and don't note down everything. Just mark the keywords and the task verbs in the role play card. And then if you really want, you can jot down your introduction, but nothing more than that. Please don't do it. Probably 1 or 2 points or maybe meanings of words. You can do that as you prepare. But your 3 minutes is a lot of time, guys. Trust us.
Yes. And acknowledging is also very important. See, when I say, when I express my concern, ma'am did tell that it is quite reasonable. It's a nice question. So these are some phrases for the acknowledgement. You have to acknowledge the concerns of the patient.
We hope you're making notes for all of this. Please make sure to jot it down, to note it down with a pen in your books so that you will be using the same for other conversations. Now you see, as we were saying, the patient is 55 years old. They have end-stage renal disease, ESRD. You see that their health is steadily deteriorating. They are an inpatient on your renal ward and you notice that they appear lonely and depressed. They require dialysis 3 times a week and is a candidate for a renal transplant. So you have understood all these things and please see here it's given as their health is steadily deteriorating. Yes, they are an inpatient.
It's a known case.
It is a known case. And on your renal ward, that's also important, on your renal ward, and you notice that they appear lonely and depressed. Well, please keep in mind, understand that you can't ask these questions directly. Don't say you look very depressed. No, you're not going to say that. You're going to start off with how they're feeling today. That's the very basis of your conversation. That's why we say your first draft is quite tricky. Please understand how to go about that. They require dialysis 3 times a week and is a candidate for a renal transplant. So let us look at the task verbs now. Ask the patient to tell you how they are feeling. Encourage the patient to talk about their fears about the condition. Next, inform the patient that without dialysis, they will suffer more. Reassure the patient that there is always hope. A donor will be found in time. Suggest that a counselor be consulted to support their decision to be listed as not for resuscitation, NFR. So, our students sometimes they have doubts regarding what not for resuscitation is.
Yes.
So that will be cleared in a few minutes. Provide reassurance, very important. Assurance and reassurance are key factors in the role play. So provide reassurance that if they want to put their request in writing, it is hospital policy for staff to respect that, and having the family present is important. We will give you a quick few seconds to click a picture of this particular role play card. Understand the background to the patient properly. So we will be starting the conversation. If you have any queries, you can quickly drop them here in the live chat box. We will get back to you immediately. All right then. We hope you are ready because we are ready. We are always ready to help you out in understanding how the conversation works and how role play works. So let's see. So you will be the patient, and I'll be the nurse, right? And so we have our respective cards with us, and also to clear a doubt that if anybody has, you will not get a chance to see the patient's role play card. So if you have those, please don't practice with those. Practice only with the nurse's card and use the patient card or the patient's caregiver card, whatever, the patient's card, just as a prompt to help with your conversation, and don't get fully dependent on that. So keep looking only at the nurse's card, practice with only the nurse's card. So shall we start?
Yes, please.
So before we start, we are going to note down the name of the patient because this patient has been on my renal ward for quite some time, and I have been observing the patient for quite some time now. Their health is steadily deteriorating as they have ESRD, and I also noticed that they appear quite lonely and depressed. Right? I know their routine that they require dialysis 3 times a week. So all these factors help me understand that this is a known case, right? So ma'am, what are we going to be addressing you as?
Abraham?
Abraham. So you're 55 years old?
Yes.
All right. Okay. So shall we start?
Yes, we should start now.
Okay. Good morning, Abraham.
Good morning, nurse.
How are you feeling today?
Well, I'm not okay. Well, I have so many concerns. I am losing interest day by day.
Oh my God. Please, Abraham, don't say such things. You don't have to worry at all. We are there with you always. But you do look quite anxious and low. May I know what's concerning you?
Well, I'm worried about my present condition. I do know somehow, even though I try to be positive, it is always the negative things that comes into my mind.
Okay.
I hate dialysis, and sometimes I feel the donor will not be found in time.
Okay.
This is a cheap concern. So I'm feeling very lonely. I'm totally depressed, is what I can say.
Well, Abraham, we do understand what you might be going through. We have patients here on the renal ward who are in similar situations, but please let me reassure you that we are with you at all times. And, it is always good for you to talk about your fears and to share it with one of us. It, lessens your burden. But apart from that, you did mention about hating dialysis, right?
Yes.
But dialysis is very important given your current condition. And as of now, you need it 3 times a week. So you'll have to undergo dialysis thrice a week If not, you'll be suffering more. There'll be a lot of pain that you will have to suffer, and we don't want you to go through all that. Yeah. And you also mentioned about the donor. You see, we put you on the renal transplant list a few months ago, and let me tell you, you're on the top of our waiting list. We are keeping our fingers crossed because we're actually hoping to find someone pretty soon, and things are on the way. You don't have to worry at all. Please keep your hope and remain positive. A donor will be found in time. Don't worry about that at all, Abraham.
Well, may I request you something?
Yes, please.
Well, I want to be nominated as not for resuscitation. If at all, I have a cardiac arrest. Will that be possible?
Not for resuscitation, is it?
Yes.
That's a big decision to make. Well, we certainly respect your decision, but may I suggest that you talk to a counselor and, talk to them regarding NFR, and you can also seek the support for your decision to be listed as not for resuscitation. Would you be willing to do that? I can definitely fix an appointment with our counselor, in-house counselor, and they'll be coming to your ward and talking to you. Would that be all right?
No, I'm not comfortable speaking regarding this with anyone. I hope you understand my situation or condition for that matter. I'm happy staying lonely and I'm happy with that. I don't want to meet anyone.
Well, don't say that, Abraham. You're not lonely. We are all there to support you. And talking to a counselor will only, give you support for the decision that you have taken right now. And if at all you want to be nominated as not for resuscitation, you will have the counselor's support. And let me reassure you again that if you want to put your request in writing, it is the hospital policy for us staff to respect that at any cost. All right. And we also understand how important it is to have your family present during such important decision making.
Well, so did you say that meeting a counselor would really help me taking up some strong decisions?
Yes, that's right. It would definitely help and strengthen your request.
Well, in that case, you may please proceed and book an appointment with the counselor. I would like to meet your counselor.
Well, definitely that will be done in no time. You know what I'll do? As soon as possible, I'll be talking to our in-house counselor right away and scheduling an appointment.
Yes, you may proceed with talk.
Okay, then I'll just do that and I'll get back to you immediately. Will that be okay?
Yes, that should be okay. Well, I have one more request as well.
Yes, please.
See, I know that it is quite risky in my case. Well, if at all I die, I want to be able to die with all the dignity with my family being present.
Well, that is a request that we would love to honor, and we always respect the decision of the patient. So don't worry at all. We know how important it is for you to have your family there with you at all times, and we will make arrangements for everything. But let me tell you, Abraham, that you have to be really hopeful about this, and we are from the hospital side, very hopeful about finding a donor in time, and will lead a healthy life. Don't talk.
It is a lot.
So this conversation was about a patient who is lost, and they're really very depressed about the situation they're in right now with ESRD, right? And the nurse has tried to talk to them, convince them, and manage their. Because I was the one who is the nurse here. So I've tried to convince the patient, and the patient has also agreed to see a counselor and talk to them. Hope this conversation was helpful.
Yes. So I hope we have helped you in the preparation of a speaking module.
And we have done 2 sample tasks for the day, And any queries that you have with regard to these tasks, you can always get back to us here in the chat box. We will give you a few seconds. And any questions that you have, please let us know.
Well, Dr. Ansha, why don't we give our viewers tips regarding the preparation? What do you say?
Definitely.
So to sum it up, that what we can say is first understand your role play. So you have to in such a way that it will not exceed or 3.5 minutes. Therefore, specific to your working scenarios, and definitely you would have been given instructions or procedures, and every single detail of the patient would have been given. And we have already spoke about this marking criteria. So time limit is very, very important. And we have also spoken about these criteria where it is very important to use clear and concise language. We have also spoke about the active listening. Being a good listener is very, very important. And we have also spoke about the attitude, professional attitude, tone to be managed all through your conversation. So here are a few tips that we would like to give you to improve yourself in the speaking. The first thing is nothing comes like a miracle or a blessing. So definitely it comes with practice. Language is something that you practice more. More perfect.
Yes, you have to practice. And one thing that we also keep repeating in the class is please do not hesitate to speak. When you're given a chance to speak, please speak. And even if not, create an opportunity for yourselves to speak and practice regularly. Spend time reading out loud. There's nothing better than reading out loud. Reading out loud will help you with modulating your voice and getting to understand the nuances of it. And you'll also, there'll be more clarity in your pronunciation. And you can also record yourself, as it is stated, record yourself and listen to it again and identify the areas that need improvement. Is it with the word? Is it the pronunciation? Is it the way that I'm stressing on a word? So these things matter a lot.
And the second point is to focus on the stress and intonation. So you cannot just say anything out. I can't say just, well, don't worry, I'm here to help you. Please don't worry. There are many patients like this. Something like that doesn't make any sense. When you know where to stress,
Yes.
Do not worry.
Yes.
We are here for your help. Please do not feel lonely. You are in the right place. Please do not worry. See, it should sound natural.
There is a wave. Yeah, there's a wave, there's that natural flow when you speak. So that has to be maintained. And we are not asking you to be dramatic in any which way. This is not about, we are not being dramatic at all. We are just asking you to face stress and also make it sound natural. The way you're pronouncing a word and the way you're conveying the meaning.
And one more thing, if you're not very sure or confident about the accents, please don't practice it. Very, it looks very, very dramatic.
Yes, it does.
So if you're confident enough, you can just try, or else please no. You can convey your message with a natural flow.
Yes, you can see we are not, OET is not interested in understanding and knowing what accent you're using while speaking. That is not one of the assessing points. The only thing, the main criteria is for you to have clarity in pronunciation. Clarity of thought. That's important.
And then it's all about how you would manage the situation. That's it.
Yes.
So feedback provides it is a great tool that I would say that if at all you are interested in improving yourself, definitely feedback plays a role in that. You can either ask your friends or fellow people, those who are preparing for the OET, and the best people would be your tutors.
Yes, your tutors, listen to what they say, listen to what the instructor, your trainers are telling you and asking you to do. And if at all you want to, you can also get in touch with us through our classes. So yes, we will be there to provide you feedback with every sentence that you say and with how you say it, with the conversation, with the entire conversation.
And you can also improve your pronunciation. If you're doubt, please check. There are a number of online resources now. Please check and be confident in the pronunciation. So it is very important to understand the context that I think we have already spoke about these things. I think we move on to the next slide.
Sure.
So you can have some sample scenarios, you can prepare your content, start speaking, assuming that you're speaking with a speaker. And the important tool that's going to help you is like record your voice and listen. As a listener, definitely you will find some places where you need some improvement. So seek feedback and definitely join the OET practice group where they'll be working towards the same cause.
Yes, goal-oriented tasks, yes, goal-oriented preparations are very crucial to clear OET in your first attempt. Be consistent with your practice, and I say in no time you'll be able to clear your exam in the first attempt.
Yes. Well, these are the common mistakes and that you should avoid. Mm-hmm. And the first thing is using jargon. And we have stressed this so many times in today's class that the interlocutor might be or might not be of the medicine background. And the agenda is to communicate. That's it. So there are different types of communicating. You need not be, as we normally say in the word, you need not use Shakespeare in English.
Yes, you won't. Nobody uses it now.
Yeah, simple, clear. The opponent should understand what are you trying to convey. So use simple and clear language. So jargon is nothing but the technical terms. So the interlocutor might be unfamiliar. So you should be very careful using such.
So if you're using it throughout the conversation, then that is definitely going to be a problem. If you have the habit of doing that, and if you have the habit of using textual language in the spoken form, then that's one thing that you have to avoid and practice in a different way. So please make sure that you're not using textual language, because the textual language is different, spoken language is different, written language is different. So it is important for you to understand these variations and use it accordingly. Let your language be very simple and clear.
Well, the second point and the third point are somehow related to the confidence. So when you're confident, obviously, you will have the correct posture and the eye contact. When you lack it, it does say that you're not confident or you're not trusting the person. So maintaining the eye contact with the examiner is very important. Obviously, that will not be seen, yes, but definitely your confidence can be seen. Yes, in the way that you are conversing.
Yeah, in the way you're conversing and in the recording, it will clearly be heard in the recording. So please make sure to have proper eye contact with the
correct posture as
with
well.
the interlocutor, but don't stare.
Yes.
You're not having
an eye contact and staring as a big difference.
Yeah, that's a big difference. Please maintain proper eye contact with the interlocutor and who will be playing the role of the patient or the patient's caregiver in the scenario.
Yes. So avoid speaking too fastly or too slowly. You have to maintain the same speed all through your conversation. So use appropriate fillers and please don't pause a number of times. So that will affect the fluency.
And here, Roshan has asked us any exercise to improve pronunciation. Roshan, we hope you are with us. You're still continuing to watch us live. So please understand that continuity, consistency with practice is what will help improve your conversation and also the pronunciation. Well, as ma'am already pointed out, there are resources on the net. For example, if you have a doubt with a word, how it is pronounced, you can always log into Oxford Dictionary and you can click on the audio there. You will understand how a word is pronounced, how it is supposed to be pronounced in different accents. When you have the British, the American, Australian, you have different accents being placed there. Now understand that we are not native English speakers, but we actually follow the British English pattern, right? That is called the RP or received pronunciation. So we follow that. So make sure to listen to the British pronunciation of that particular word and use it. You don't have to use that accent, I'm telling you. You don't have to use the accent. You will just catch the pronunciation of the word.
Again, time limit, as we've already told during preparation, only you should be smart enough in preparing your content. So it should neither end at 3.5 minutes, nor it should take to 5.5 minutes. So as soon as they say that time is up, please try to end your conversation within 3 or 4 seconds. And there are good sites where you can practice your tests. Rely on the tests. When you are searching for the sources, it's very important to rely on the important and trustworthy sites.
So we have another question here which says, how to think through before speaking and give a structure to our conversation so that others are able to comprehend us? Well, this is where the preparation time comes into being. The 3 minutes preparation time is crucial for the candidate, and please make sure to look at it. The structure is already provided in the role play card, so you don't have much to do here, right? You have the role play card in front of you. You have a paper to write down or to jot down the points, so you don't have to worry about it. Go through the sequence of tasks that is given in the role play card and just speak accordingly. We hope we have answered your question there.
Yes.
Well, you're always welcome, Arushi.
Well, we hope we will be some help in your OET preparation. You can always reach us out. So you can find the contact numbers and other details in the chat. So you can please use those numbers. You can visit on site. We do have the campuses in Gurugram and Mysore as well.
So you can give us a call if you have. You can get back to us, and we will be getting back to you immediately. So we hope this session was fruitful, And we will be seeing you again next week with another interesting task and a module. And please brace yourselves to be available at 1:50. Join in. Click on the notify me button on WhatsApp. Sorry, on YouTube. I'm so very used to WhatsApp. Anyway,
The subscription code help you. So please do subscribe the channel.
we will be seeing you every Wednesday at sharp 2 o'clock IST. Until then,
Signing off, Nagashri.
and this is Dr. Anusha.